Hi students, in this presentation we will see about the basic principles which are required for preparing teeth for receiving either full or partial coverage restorations or simply in other terms crowns. So what is a tooth preparation? So after endodontic treatment or a tooth fracture, or we have to replace the color of the teeth or change the shape of the teeth, each tooth has to be prepared to receive a crown. So this crown is a dental restoration, which is a fixed restoration. So it's a fixed prosthesis. So any preparation which is done to receive a fixed prosthesis on a tooth is called as a tooth preparation. In another terms, according to GPT 9, the process of removal of diseased or healthy enamel, dentine or cementum to shape the tooth to receive a restoration. A restoration can be either partial restoration or a full coverage restoration. So the principles of tooth preparation are 5 in number. The first one is preservation of tooth structure. The second is retention and resistance form. Third is integrity of margins or marginal integrity. Next is structural durability and then preservation of the periodontium. The same principles can also be reorganized or described as biological, mechanical, or aesthetic principles under these headings. So let us describe or let us go deep into each of the principles in detail. What is preservation of tooth structure? The tooth structure must be prepared to receive different crowns. So it may be all ceramic crown or a metal ceramic crown or an all metal crown. But the preparation should be modified, or the amount of tooth structure should be modified depending on what type of restoration is being given. For example, in areas where there is a metal coverage with ceramic backing or a ceramic layering, the tooth structure removal should be more, whereas in areas where there is only a pure metal coverage, it can be made as thin as 0.5 to 0.7 mm. So the tooth structure reduction should be lesser. So this ensured that the tooth structure is not arbitrarily removed, and it is removed only, or preparation is done only according to the desired prosthesis. So after the tooth preparation, whichever tooth structure is remaining, it must be strong enough to resist the occlusal forces. This is also very important. We have to take care, make sure that after the tooth preparation, the remaining tooth structure doesn't weaken. So this means that the tooth preparation must not be too weak so that it will break or fracture after tooth preparation. Retention and resistance. This is the second principle. Retention refers to the prevention of displacement of restoration along the path of insertion or long axis of the tooth preparation, whereas resistance refers to prevention of removing the restoration by forces directed in an apical direction, that is towards the gingiva, so that the restoration or the tooth structure doesn't fracture. The most important part of retention is presence of two opposing vertical surfaces in the same preparation. It could be the buccal, lingual, mesial distal surface of the tooth preparation in a full crown, or it could be the internal walls as in an inlay cavity. So this presence of two, either external or the internal walls, offers frictional resistance to displacement of the restoration. So let us see what are the factors affecting retention. First, taper, freedom of displacement, the length of the preparation, internal features, and path of insertion. The walls should be tapered roughly 5 to 6 degree, which means per wall it has 2 to 3 degree taper. So the total or overall taper of the preparation is 5 to 6 degrees. So this provides a ideal taper to offer frictional resistance to displacement of the prosthesis. The same degree of taper should be applied to inlay preparation or internal preparations also. Note that for inlay preparation, the walls must diverge occlusally, whereas for the crown preparation, it must converge occlusally. Freedom of displacement refers to the numerous directions or the multiple ways in which a crown can be removed from the preparation. Increasing the taper, as shown in picture B, can make the displacement much more easier, which means the processes can be displaced in multiple planes. So this should not happen, and the preparation should be such that the displacement is confined, or the path of insertion and removal is confined to a single direction, as shown in picture A. The length and diameter of the preparation play a very important role. It is noted that the increase in the length, as shown in picture A, increases the retention. However, the increase in width does not increase the retention form. Rather, it tends to increase the length of the arc or the arc of rotation, thereby making the preparation displace easily, as shown in preparation B. Hence, a shorter diameter tooth preparation offers greater resistance to displacement compared to a longer or a bigger diameter tooth. The minimum height of the preparation must be at least 5 mm. This is very important clinically. So when we are looking at any tooth preparation, we find inadequate crown length, then we have to notify the patient that further measures are required to increase the crown height. It could be either crown lengthening or extrusion of the tooth. The final processes should rest on sound tooth structure, which is at least 5 mm in height. The retention form can further be increased, or it can be made better by substituting internal features such as the grooves or box forms. These are very common in partial veneer crowns as the 3/4 crown or the 7/8 crown. Sometimes pinholes can also be made to increase the retention. The path of insertion is the last factor, and the path of insertion should be such that there is only a single path of insertion and removal of the processes, so that there are no multiple directions in which the processes can be displaced. Going on to the next principle, marginal integrity. The marginal integrity refers to the difference in the type of preparation to suit the type of restoration. So we have basically three types of margins, or if the margins are otherwise called as finish lines. So what is a finish line? Finish line is the area where the restoration should rest on, or it should end. So the margins of the restoration is well defined according to the type of the processes. Briefly, there are three types of margins. One is a shoulder, chamfer, and the knife edge. So marginal integrity refers to how closely the processes adapts to this margin, so that it can survive the bacterial and fluid challenge inside the oral cavity. The margin can also be placed in three positions, either as supragingival, equigingival, or subgingival, depending on its relation to the gingiva. Supragingival refers to the margin which is placed above the gingiva, whereas equigingival, the margin is placed at the level of gingiva, and subgingival, the margin is placed 0.5 to 1 mm inside the gingival margin. So basically, we have different finish line configurations: chamfer, heavy chamfer, shoulder, shoulder with bevel, or knife edge. Briefly, all metal restorations will receive chamfer finish line, and nowadays we have all ceramic restorations also receiving chamfer finish lines. Heavy chamfer again is a finish line which we give for all ceramic restorations like zirconia or Emax crowns. Shoulder is a restoration, is a margin which we give for restorations with metal backing, such as the porcelain fused to metal crowns. Again, shoulder with bevel is a modification of the shoulder margin, where the preparation margin is supposed to be hidden inside the gingiva, so that the metal is hidden inside the gingiva with a bevel. Knife edge is used in cases of abnormally long preparations or abnormally long teeth or tilted teeth, where excessive preparation or giving a margin such as the shoulder or the chamfer could lead to loss of excessive tooth structure material. So these are the different types of finish line. Shoulder, preferably given in case of porcelain fused to metal, and beveled shoulder in case we want to hide the piece of metal inside the gingival margin. And the chamfer is a a rounded finish line with an angle of 130 to 150 degree on the internal surface. Shoulder is a margin which has a joint or has a 90-degree angle on the internal surface. So this is very commonly given in case of porcelain fused to metal restoration. The knife edge finish lines are given in cases of long tooth preparations or teeth which are tilted. These typically are very thin margins with an angle of less than 3 degree at the margin. The next principle is the structural durability. So structural durability refers to the ability of both the tooth and the restoration to resist functional forces. So this is dependent on occlusal reduction, the functional cusp bevel, and the axial reduction. Occlusal clearance for different types of restorations are different. For example, all metal crown receives 1.5 mm functional crown and 1 mm for the non-functional cusp. So it could go as high as 2 mm for all metal ceramic restorations. So this difference should be proper so that the functional cusp which is going to receive the heavy functional forces is able to resist the forces without breakage. Similarly, we have to give a functional cusp bevel. This bevel ensures that there is adequate space for the restoration in the functional cusp so that it can resist the forces. The axial reduction refers to the preparation of the axial surfaces or the long axis of the tooth. So this also depends on different types of restorations. For example, metal restorations will require lesser axial reduction compared to metal ceramic or all ceramic restorations. So this plays an important role in securing space for the adequate thickness of the restorative material. The last principle is the preservation of periodontium. Preservation of periodontium refers to the preservation of the biological width. The biological width refers to the attachment of the connective tissue plus the epithelial attachment, which is roughly 2.04 mm. This biological width should not be encroached upon by the restoration. When we place the margin of the restoration, we have to ensure that the margin does not disturb this attachment apparatus. If it disturbs, it can lead to inflammatory response inside the gingiva and can cause loss of attachment or apical migration or recession of the gingiva. All these factors could lead to failure of the restoration. So this we have to be very careful, especially in case of subgingival and equigingival margins. So with this we come to the end of the presentation. So here we have seen the 5 basic principles of tooth preparation and how we can achieve a good tooth preparation for a successful clinical restoration. Thank you.